It was just about a year ago that President Obama was promising his health care overhaul would save the American people money.
The cost of this plan will not add to our deficit. The middle class will be rewarded with greater security, not higher taxes. And if we're able to slow the growth of health care costs by just a fraction of 1% each year, we will actually reduce the deficit by $4 trillion over the long term.
Okay, but that was then, and this is now a different tune.
As a consequence of us getting 30 million additional people health care, at the margins, that's going to increase our costs. We knew that. We didn't think that we were going to cover 30 million people for free.
Okay, Peter Johnson Jr. joins us. Interestingly enough, both those comments on September 10th, 2009, 2010. What happened?
Yeah, good observation. What happened is the rubber met the road, and reality is trumping politics now, and the chickens are coming home to roost in some sense. What happened is the president is now faced with the reality that people are going to be paying more and receiving less for Medicare. Mm-hmm. The reality is that people who are not necessarily going to be able to keep the plans that they have. The reality is the deficit projections are going to be different. The reality is, as exposed the other day, that health care costs are actually going to increase rather than decrease. What the president was saying is, well, we're going to add 30 million more people, and it's going to cost less, and we're going to reduce the deficit, and everything's going to be great. And so now Americans are coming to the realization that everything is not so great.
Right.
And so what's happened now is the insurance companies are speaking up.
Right.
And so they're saying 1 to 9% of the costs increase that we're giving in this year are directly related to Obamacare. Mm-hmm. And so you know what happened?
I do, but go ahead.
What happened in response to that is Secretary Sebelius came out with a big stick and threatened the insurance industry and said, listen, if you do that, we're going to keep you out of the insurance exchanges in 2014. Let's see what she said.
She said, quote, there will be zero tolerance for this type of misinformation and unjustified rate increases. Simply stated, we will not stand idly by as insurers blame their premium hikes and increased profits on the requirement that they provide consumers with basic protections. So, Peter, essentially what she's saying to insurance companies is keep your mouth shut, or you're going to lose business with the federal government.
Or we're going to shut you down.
Yeah.
What we're saying is that there's a First Amendment for some folks, but not a First Amendment for these folks in terms of saying to their subscribers, listen, health costs are going up. Mm-hmm. There are things that we can't control, and on top of that, we have to meet new mandates of the federal government that are going to increase your costs. So the federal government says, we're going to punish you for saying that. That's wrong.
That is wrong. All right. Peter Johnson Jr., another prescription for truth.
Have a good week.
We thank you, sir.
Okay.
Indeed. We'll see you later.
Thank you.
Meanwhile, she's the